PCOS is one of the most discussed female diseases on the internet in the past 5 years. The quite obvious reason for this is an alarming increase in the rate of PCOS. And this topic is not something that we can discuss over one short video or even a single long video. So we have come up with a series of videos for this topic, PCOS. Welcome to Seema A N Ayurveda YouTube channel. This is Dr. Seema, practicing Ayurvedic gynecologist in Atinagar, Bangalore. This is episode 1 of PCOS series, and the objectives of this video are twofold. A, to understand PCOS better by drawing relevant discussions on the disease that is available in both Ayurveda and conventional system. This is crucial for early diagnosis, prevention and management of the disease. 2, to address certain misinformation on the internet about PCOS. PCOS is a multi-system hormonal disease where metabolic disturbances are expressed on the ovaries. In fact, in many patients, the disease does not even begin in the ovaries. These might just be areas of expression for the metabolic and hormonal disturbances going on throughout the body. Although the exact cause of PCOS is not known, postulated causes for PCOS are genetic, familial, environmental, poor diet and lifestyle, and psychological stress. Important pathogenesis includes insulin resistance and increased male hormones or androgens. There is also suggestion that even chronic low-grade inflammation and autoimmunity could be contributing factors. Inflammation means body's response to certain injury or infection where there are tissue changes like redness, warmth, etc. Chronic inflammation is when this process continues in low grade for weeks or months together that can harm the healthy tissues of the body. Autoimmunity means when body's immune system attacks its own healthy tissues. If you observe one or more of these symptoms, it calls for visiting your doctor. Initially, it might begin as irregular and delayed periods, which might then progress into absent periods for months, which is then followed by excessive and prolonged periods for days together. It might even continue for months as well. In most cycles, egg is not released. That is, there is anovulatory cycle, which is the main cause for infertility in PCOS patients. Acne, appearance of facial hair, scalp hair thinning, thick pigmented skin, especially over the neck and armpit areas, are also seen in many patients. Sudden weight gain is also observed in significant number of patients. But then there are lean patients in whom you can observe accumulation of abdominal fat, although their body weight might not drastically increase. Although not much is documented about gut disturbances in PCOS, most of my patients have bloating, indigestion, and constipation. Quite often, PCOS is diagnosed as a part of evaluation of female infertility when the disease would have become quite chronic, like more than 10 or 15 years even. Ultrasound scan findings of multiple small follicles in the ovaries with an enlarged ovary supports the diagnosis. We also go for fasting blood sugar, insulin, testosterone, and assess female hormones as well. I particularly remember a patient who visited our clinic last year with infertility, who has a history of PCOS since her puberty. She only gets her periods once in 3 to 4 months, and these cycles are also anovulatory. That is, no egg is released in any of these cycles. And she asked me why she has this condition since that early age. So I explained to her briefly regarding PCOS and its pathology and everything. But then she said she understood what I just explained, but why did this affect her at an early age when her diet and lifestyle have been pretty decent? This is where Ayurveda helps us. Ayurveda gives us an insight into factors in our everyday routine that we do not know can either cause or worsen existing PCOS. Let me list top 10 such causes in everyday routine that I see in my patients. Sleeping at any time after 6 in the morning, especially immediately after food intake. Staying up after 10 p.m. Intake of heavy foods like vegetable smoothies or milkshakes or dry fruits and nuts, or even seeds early in the morning or for breakfast. This is the newest cause I see in my patients because these practices have been advertised as one-stop solution for PCOS, but it does not help most patients. Intake of food in between meals, like fruits or dry fruits after breakfast and before lunch. Eating more than 3 meals a day. Intake of any kind of processed, fried and refrigerated foods, improper intermittent fasting where you fast for 14 to 16 hours and eat multiple times in the remaining hours. Ayurveda does suggest intermittent fasting, but we'll discuss the correct way of intermittent fasting in our next video. Lack of physical exercise within 3 hours of solid food intake, physical exertion and intake of sour, spicy, fried foods during bleeding phase of periods, restless mind throughout day and eating food when you are stressed, angry or sad. Now what these diet and lifestyle faults do is they disturb Agni, or the factor that is responsible for digestion and metabolism on a daily basis, and also they result in derangement of Vata and Kapha dosha. These 3 factors are absolutely essential to cause PCOS in you. There is one more area where Ayurveda helps us, that is an early diagnosis. This is done by observation of period blood and the discomforts that are associated around period, which most women tend to ignore unless there is a lab report that suggests some diagnosis. A pale, thick, mucus mixed blood, lethargy and heaviness in the body around periods indicates a disturbance in Kapha dosha. Brown period blood, painful periods, bloating and constipation hints towards a Vata disturbance. So look for these symptoms and do not wait for an ultrasound scan report or blood test to diagnose your gynecological disease including PCOS. At this stage, when there is slight derangement in these doshas, you are still in a stage where the condition can be completely reversed. Seek help of a nearby Ayurvedic gynecologist for these symptoms. Now regarding the second objective of this video, that is clearing certain misinformation about PCOS on the internet. First, this disease is not just of ovaries. We have already discussed that part. Second, there are no multiple cysts in the ovaries. Rather, these are follicles which are many in number, and the difference between the two is follicles contain growing egg within them. Third and most important, there is no magical herb, seed or dry fruits that can cure your PCOS. Fourth, popping pills of any system including Ayurvedic medicines cannot help you reverse PCOS completely unless you make necessary diet and lifestyle changes along with the ongoing treatment. Fifth, natural ovulation and conception are possible in PCOS. Natural does not necessarily mean spontaneous. Natural means methodical treatment which does not involve any synthetic hormones like OCPs. As is evident, the combined knowledge of Ayurveda and conventional science can help you better for early diagnosis and prevention of PCOS and even management. The management part we'll discuss in other videos. If you have PCOS, your homework is to stop 10 diet and lifestyle faults that we listed in this video today. And if you do not have PCOS, do share this video with someone who does. Our next video is about Ayurvedic diet plan for PCOS, so stay tuned. Thank you.